you go ahead? All right. So thank you everyone for being here for our last session of the fall semester. So we have with us Professor Rizzo, and I just learned that the correct pronunciation of his Italian name is Ricci. Correct. So Professor Rizzo we're very, very happy and honored really that he has worked for us at Lasell in the past and will be in the future. His area of expertise is integrated marketing communication, and he has a lot of work experience working in the healthcare industry on IMC. Prior to that, he has held different managerial positions in different companies and currently teaches different business courses, including a course called The Global Manager, right? That's one course he's taught in the past. He has taught in Oregon at a number of universities there. He also teaches obviously in Boston, Emerson, and at Lasell. And he was honored as Faculty of the Year at a number of institutions, which is really probably the one award that all professors dream of getting. He has a master's in business administration and a bachelor's in biblical education. So maybe you can tell us a bit about the change from biblical education to
big change
to business. So thank you again very, very much for being here with us, and the floor is yours.
Thank you very much. Good evening.
Hi.
Marhaba. My wife and I lived in the Emirates for 2 years, and then I continued to travel to the Emirates for another 2.5 years doing consulting work. So I taught in an Arab women's college in the Emirates, so it's nice to see some students that look like my students. The Faculty of the Year, that was for online teaching. And the great thing for an instructor about online teaching is that it's very easy to look brilliant. If a student asks me a question online, and I have no idea what the answer is, I don't have to answer right away. I can go look something up, look online, look in a book, compose an answer, get back to them, and they think, this professor knows everything. So if I had to vie for Faculty of the Year for face-to-face, I don't think I would come close. Because in a classroom, you have to admit, I have no idea. What we're going to do this evening is we're going to look at integrated marketing communications. Rather than me lecture you on principles about this, I thought it would be more interesting to go through an actual IMC campaign that I designed and implemented for a hospital in the Emirates. And we will go through the research stage, what the message was, and then how it was implemented, and maybe discuss some IMC principles along the way. The reaching diverse audiences with a clear message. If you have marketing experience or have studied it, reaching one audience with a clear message can be a challenge. Reaching very culturally, linguistically diverse audiences can be very, very difficult, but in many cases it's required. So what we tried to do was create a consistent brand message across both traditional and non-traditional communication. Well, let's have a look. The marketing situation that this hospital faced. This is Oasis Hospital in the city of Al Ain in the Emirate of Abu Dhabi. Hospital was established in 1960 when most of the surrounding area was simply desert. Al Ain at that time was a small village. So first hospital in that area. It grew, the town grew. Al Ain is now a major city. They have a new facility that was built in 1989. However, they have two major competitors that have grown in that time. And both of those major competitors are now larger and more successful and better known than Oasis. So my consulting work partly consisted of how can we get Oasis, instead of being far behind, let's bring them up to the level of the other competitors, gain some market share back. So we created an IMC campaign. We created the campaign with three groups in mind. National families, Emiratis, many of them go to a hospital just to see a doctor, so they rarely go to a doctor's office outside of a hospital. So this was a major source of health care for them. And then what we called expat pros, expatriate professionals, Western professionals that were there working in a number of industries, most of whom did not speak Arabic, had a very, very different cultural background from the national families. So two diverse groups. And then market research showed us that many of the large employers the expat professionals worked for would go ask their HR director for a recommendation. My 5-year-old is sick. Where should I go? What's a good hospital? What's a good doctor? So the HR directors were in a key position to make recommendations to send people to any of the three major hospitals. They were a key group that we needed to reach. Most of them were Indian background, very well educated, but again, a distinct group from the other two. So we had three different groups, different cultural backgrounds, different educational backgrounds. We had to create one campaign that would communicate a clear message to all of them. The problem, identifying a problem that you're trying to overcome, a major part of any marketing, but especially an IMC campaign. The Nationals looked at this hospital as it's old, it's been around forever. At the time we started this IMC campaign, it was celebrating its 50th anniversary. And they looked at the other two hospitals as much more modern, up to date, and that would be their first choice of where to go. We had a little bit of a rude awakening. There is a medical school in Al-Ain, and we had a group of 22 medical students come and do some of their work at the hospital. And we took a survey of them for how many of them, and these were members of the local community, how many of them would choose Oasis Hospital as their first choice of where to go? 0. They were getting their medical training there, but their experience did not convince them that this was the place to go. So we had a lot of work ahead of us. We had little or no real reputation among the other two groups. They simply didn't know very much about us. And I have some information on the survey and focus groups that we did, which I'll bring up here in the next minute or two. But this was the problem. Kind of a bad reputation and then no reputation. There we go. In marketing, the way I prefer to do marketing, especially when it comes to reaching different groups with the same message, is the message has to be simple. Very, very simple. We like to believe that we can communicate something complex, a complex idea to a lot of people at the same time. No, we're just not good enough to do that. So the message has to be easy, simple, something you can put in one phrase or one sentence. And then the entire IMC campaign was built around communicating this to the different groups. The research showed us, we'll get to the research in a minute, that our three groups did not view Oasis Hospital as a modern facility. So we wanted to communicate the idea that this is a 21st century hospital. It was very modern, though the outside did not look that way. Full service. There were very few medical services that Oasis did not offer. It was known as a maternity hospital, but that's how it started. But it had grown to a great degree beyond that. And finally, friendly. If you are still around in the US in 2 years for the 2016 presidential election, you will hear strategies, polls, which candidate is pulling ahead, which one's falling behind, which one had a bad day. But consistent research shows people will vote for president based on whether or not they like the person. It's an emotional decision. Many of the decisions we all make, even me, I look at myself as I'm this highly logical person. No, a lot of my decisions are emotionally based. So if people like an organization, the people are friendly, they're more likely to choose to go there. If you have the greatest doctors in the world and you have the greatest equipment in the world, but people don't think you're friendly, they're simply going to go somewhere else. So this was our message we had to communicate. Very simple, we got it down to these little phrases. Then, just as a practical matter, when I worked with the marketing director of the hospital, and we were designing the IMC campaign, working on marketing materials, we actually printed this on a banner, put it on his office wall, so we could evaluate everything we're doing. Does it communicate this? Do our three groups get this message from what we're working on? So we started off redesigning the website. We'll get to that a little bit later. We finally abandoned that. But every single page on the website, we were going to evaluate it. Does it communicate this? So your message should be, you should have your message written down, specific. This is what we are trying to communicate. This is titled Survey Results. This is a compilation of surveys and focus groups for interacting with some of the Emirati women who were reluctant to talk to a foreign man often. So we used other women from the Women's College to conduct focus groups, and we had them rank things in order of importance. So they had to choose which one was number one. We came out with, finally, information that we could use. Among the nationals, about 30% thought that Oasis was a modern hospital, so 70% did not. 23 thought full service. Slight majority regarded us as friendly. One other factor that we were very careful about, culturally respective. We wanted to respect the UAE culture, which the hospital had a reputation of doing. But as we conducted this IMC campaign, we wanted to avoid anything that would change that. And so this number was great. It had been 50 years in the making. That was something we kept in mind, is we do not want that to go down. Among our other two groups, expat professionals, the numbers are pretty dismal. Only 19% of the expat professionals regarded as modern. About the same for full service. Some thought it was friendly if they had heard of it. Many had never heard of us. And finally, among the HR directors, the worst numbers. 11% thought we were modern. 0 knew anything about the services that the hospital offered. And finally, 16% thought they had heard that the hospital had friendly people. So quite a hole, and we were going to try and climb out of it. If you ever get the chance to be a consultant in the future, pick a place, pick a client that's a mess. Because it's a lot easier to make positive changes in a place that's a mess than to take something that's wonderful and try and make it better. So this was a mess, which was fun. We decided to create specific IMC goals for the campaign. Establish a reputation as a 21st century full-service health center. That's among our three groups. Create a consistent image among the diverse groups, so they all thought this. And finally, we wanted to, in terms of marketing goals, increase the use of our overall services by about 15%. And we had several specialties, medical specialties, where we had highly trained people with almost no customers. So those had much higher goals to increase. For example, we the hospital had recruited a respected eye surgeon, and he had a room full of the most modern equipment, and he had nothing to do because we couldn't get any patients. And there were many people in the community that needed eye surgery, the benefit, their vision would improve. So we had some specialties that we definitely wanted to bring in a lot of patients for. Some numbers to our goals. The gray area shows the original survey and focus group numbers for our 3 target markets, and yellow is the new goals. We left this one unchanged, determined not to hurt it at all. So we decided, let's be a little optimistic. This was a 2.5-year project. So we thought we could get nationals up to 60% for both modern and full service. And since they already had a slight majority, they thought we were friendly. Let's go a little higher with that. And we thought these were achievable goals. Expat professionals. In these 2 categories, there was a reason we didn't go very high. This group was very hard to reach. There were no publications, there were no television, radio stations that targeted this group. So trying to reach them, and there were several thousand, there was no channel in which to do that. So we thought through some of our IMC campaign we can reach them, but trying to get big number increases would be very difficult. So 40%, and then we thought maybe we can get them to regard it, get a good majority to regard it as a friendly place. The HR directors, we selected the largest employers in the outlying area. It influenced the most people, and this was a much smaller group. It was about 80 to 85 HR directors. So we thought with a group that small, we can probably have a bigger impact. So even though our initial numbers were much lower, we thought we can raise those higher. So the goal of 50% for both of those, and then 60%. So, yes, next slide. Thank you. So the IMC elements that we decided to use, and then I think we added one more, which you'll see in slide 2. Culture of the organization itself, I think, as all of you know, it's any contact that you have with a customer, whether they are in the hospital, they see advertising, they look at a website, any contact constitutes integrated marketing communications, and we wanted the same message to be communicated all across those. So advertising, direct marketing, we just made the list. We included one more based on a strategy that we implemented, and that's what was called recommendations, because the hospital would get business sometimes from recommendations from optometrists or others. So that one appears a little bit later on. Next. Then we did a little more research. Every marketing campaign should be based on facts, and often the facts aren't there. You have to go find them. So we, again, using focus groups and surveys, found out what is the best way to communicate with our 3 groups. For nationals, and this surprised us, across all 3 groups, no one looked at the website. No one had any interest in looking at the website. And we revised the website, still didn't matter. It just did not, that's not how they looked to get medical information that they made decisions based on. So after beginning to work on the website, we suspended it. We finally abandoned that simply because it's a lot of resources to put in when our data is telling us that it doesn't matter. The hospital, in-hospital experience, face-to-face, very high for all 3 groups. Another one, advertising, we were surprised it was low. Our research showed us that Oasis Hospital is a nonprofit and what they call a charity hospital, very different from a for-profit business. And the community told us they regarded traditional advertising as very offensive coming from a charity hospital. So advertising was simply out of bounds. Remember, our 94% culturally respectful. We did not want to infringe on that. So the expat pros and HR directors, no, they didn't pay attention to advertising when it came to choosing medical provider. Direct marketing, high and some, we went through and picked, especially the ones where it was high all the way across. And so we had philanthropy, a personal visit, and then there's recommendations. They prefer to be recommended by a friend, another professional that they know. So this opened our eyes to some things where we were wasting our time, and other things where if we focus there, we can actually reach these groups. Next. So starting with communications priorities, the ones that were high all the way across, or at least two of the groups. We have the in-hospital experience, personal visit, recommendations, and sales materials. Those are the four we decided, let's put most of our efforts into those, and that's what we'll focus on first. We'll spend some time on the ones that were moderate, with groups, and little or nothing to what was low. Sometimes an integrated marketing communication campaign does not include everything that you think it would. We thought a website and advertising would be key components until our research showed us, no, that's not the way to reach any of these groups. So we had to follow what the data said, relegated down to much lower priority, focused on those. Next. So first, we tackled the idea of, is Oasis Hospital really a 21st century institution? Do we actually have electronic devices that do something? So we started taking pictures. And our research and discussion, again with focus groups, is things we hadn't thought of before. People equated a modern medical center with three things. Technology. This one surprised us. Pictures showing brightly lit scenes. If you had, looking the corridor out there where it's a little dim, we showed people pictures that we took. Once we got this from a few people, we went and took pictures of the same exact scene in the hospital. Brightly lit, dimly lit. And showing doctors showing things. Consistently, all three groups said, if it's brightly lit, they always chose that as, I think that place is a modern medical center and the other place is not. Even with the same room. So, bright scenes communicated our message. And finally, professional dress. If you see someone, a doctor, without a tie, they thought that person was less qualified than a male doctor with the tie. So professional dress was the third factor that all three groups equated with, they are a 21st century professional medical institution. Surprise us a little. Me, talking to you. I know, have experience teaching at Lasell, knew that I could come here without a tie. Wouldn't make a difference in how you regarded me. But I thought, if I wear a coat, that might make a difference. I was doing the same thing. Evaluating how you would look at me and conclusions you would draw from my professional dress. So I made a compromise because I really hate wearing ties. Next, please. We worked on our sales materials, which were mostly brochures, and we started producing video for DVD, which we handed out to all three groups. We focused on the same three things: the professional dress of all of the employees that would appear in the video, very brightly lit scenes, which in a hospital, when you're doing video, it's not always easy to do. So we had to revise lighting in many areas of the hospital and something brighter. We also noticed we like it better. To us, this seemed like a more modern, up-to-date hospital. And finally, a lot of technology. So for the sales materials in the video, we focused on the MRI machine, or they have a section for premature born babies, and a lot of high-tech equipment in there. And so we decided, let's show it being used. If it was a baby being used and a nurse using it, and we would just film it or take pictures, and in the video, the person would explain what they're doing. It went over very well. Test groups from all 3 target markets thought, yes, that looks like a very modern, very friendly, great place to go if you need a doctor. Next. So the high priority, the in-hospital experience. Next. We had a reception area, a very nice lobby, but the light was low. So taking what we had learned from our research, we decided, let's see what will happen if we increase the lighting. So we put lights in the corners and up above, a lot more light in the front reception area, and then we asked people that had been coming there regularly what they thought of the hospital. And that was their first impression. Again, we got positive feedback. This is a modern 21st century cutting edge hospital just by changing the lighting. There was a small badge list that had been created showing some of the history of Oasis. We expanded that, moved it to a very prominent place right off the lobby so everyone could see it. And then our last one, normally the hospital operated with 2 or 3 people sitting behind a desk. Someone would come in, they would go up to the desk, ask questions, do something like that. But that's what the other hospitals were also doing. We needed to catch up with them. We needed to be friendlier than they were. So we took one of those people and we brought them around, and their job was to stand in front and talk to people. When they would give directions to someone coming in, where to go, they would walk them there or walk them partway there. Huge change, more than the lighting, more than even the badge list. Taking one person out of here, bringing them around, having them in front. Perceptions of the professionalism and friendliness of the hospital way up. Such simple things, and the hospital operated for 50 years not knowing any of this. I would not have suspected most of these either, but the research showed us this is how people look at you. Next. This will be a very quick one. So on the high priority list, the next, personal visits and recommendations, okay? The actions that we took. The HR directors, that group of about 85 people, we thought we should influence them a lot. The best way to do this, we thought, was let's get them all together. They really aren't competitors with each other. So we took, and this is where I had to talk to the CEO a little bit, but I said I need to borrow some of your doctors. So we rotated around, and most of these were American doctors, very highly trained, almost all of them board certified in their field, which is about the highest rating you can get as a doctor. They had some time each week for work in the community. So I asked for that time, finally got it, and I would take them one at a time and we would visit the HR directors of these major companies. They were impressed that an actual American doctor would come to their office, and so we chatted with them, and then the doctor would issue an invitation to them saying, we're having a dinner for HR directors at the Hilton. Most of the HR directors thought this is a great idea. So we ended up with about 85. We had, I think it was about 2/3, 58 or 60 of the HR directors show up for dinner at the Hilton. And we had about 10 or 11 of our American doctors, both male and female, who just circulated among the tables, talked with them, and did face-to-face contact with these HR directors who knew nothing about Oasis Hospital. They told them some of the services we offered. We explained what we did. They would talk about a case they had the previous week. The main point was simply education. Tell them what Oasis Hospital does. Finally, another idea was our highly skilled eye surgeon who sat around with nothing to do. I thought, if you've got nothing to do, you've got lots of time, then let's make use of it. So it's, again, personal visits. I would make contact with some of the optometrists who they would simply do eye tests, prescribe eyeglasses, but they couldn't do much beyond that. So they would see a lot of people with serious eye diseases. They didn't know where to send them. Well, we knew where to send them. So Tim, the eye surgeon, and I made visits to one optometrist office after the other. What ended up happening was we created something called an Oasis Partner Program, where they could put up a plaque in their window or in their office and claim that they were part of the Oasis Partnership in return for referring patients with serious eye diseases to Dr. Tim. And it started out slow, but it has grown and grown, and now he no longer has time to go out and talk to them because he has a full load of eye surgery patients, which is what we wanted. So personal visits out to key people who could make recommendations, and our HR directors, who were the source of all wisdom for those expat professionals, really started to pay off. This will be another quick one. The last high priority was sales materials. Okay. The new brochures that we created them for a number of the different specialties. Every brochure was bilingual, so Arabic and English. Even though we knew that those two cultures sometimes would look at things differently. We have time at the end, I'll mention high context and low context cultures, and we'll talk about that a little bit. But even though we knew pictures would work well and a little bit better in one, text would work a little better in the other, we decided let's make the brochures the same and simply make them bilingual. So we again focused on brightly lit scenes, technology, up-to-date, friendly, and culturally respectful. Same message. You can see the 3 points we're trying to make in that message in everything that we're doing, from the employees are dressed in the hospital, to the lighting in the hospital, to the DVDs, to new brochures. Next. From that, we moved to the ones that were rated moderate. Not a high priority, but still useful when it came to communicating with people. So direct marketing, this one got fun. Next. There was not really a mail system that we could use for mailing direct mail like you would in the US. So we puzzled a little bit over how can we direct market to our 3 target groups. So we decided to start an opt-in program where they could receive texts. And the first ones to do this, I knew from my 2 years of teaching, were the female students in the colleges. They love nothing better than to send and receive text messages. So we went and signed several hundred of them up the first day at the local women's college. They told their family, and the thing started spreading. Totally opt-in. But what we did was started featuring the interesting case of the week. A different doctor would say, like Dr. Tim, sometimes he would be able to say, did a fairly complicated eye surgery on someone who had a retina problem. He could barely see, and then much better afterwards, and I expect that in several weeks he's going to have about 85% of his vision restored. He would put in a few details, and he had some humor, and this would go out as a text. And so each week we had the interesting case text that would simply go out to all subscribers, or all of our opt-in people. And it was fun. It would be often a little bit of humor in it or something interesting, very short, but the idea was to still communicate our message, because the students at first and then their family members started getting the message that this hospital does a lot of different things. It's not just a maternity hospital. Mm-hmm. So as we had interesting cases in a number of different areas, that message would be communicated. Next. Also in the moderate category, philanthropy, which if you aren't familiar with that word, if you are, I apologize, but it's charitable giving. It's when a rich person gives something to a charity, that's called philanthropy. So philanthropy and public relations, and we decided we would combine those and try and reach our target groups. And then a wonderful opportunity presented itself. Next. 13-year-old Iraqi girl. Her father contacted someone in Iraq who was familiar with Oasis Hospital. Her daughter was born with clubfoot. She had lived 13 years not being able to get around very well. A lot of the other kids made fun of her. Her dad finally contacted Oasis and asked if there was anything we could do. So Oasis Hospital paid the expense to fly her from Iraq to Al-Ain, where the surgeons were able to almost completely reconstruct her foot and get it into its proper position. I was there on a consulting trip when she was there right after the surgery. And so Warsheen's story was something that made the television news in Abu Dhabi. It made the newspapers. And it also, we did a brief video interview with her father and with her. And clips from that were in the DVD that we created and handed out to different groups. And nationals really liked this. They learned a lot about the hospital from this. Expat professionals, a group that was so hard to reach, this was the most positive communication that they responded to, because as parents, they could identify with this dad and what he wanted for his daughter. And I don't have them in here. You can see, great smile. She was a lot of fun, but also she provided an opportunity for the hospital to just show this is what we can do. Again, none of our three groups, many of them, did not know, wow, you have a surgery that can do something like that. I thought this was just a maternity hospital. So this communicated the same message. We are a full-service hospital, high-tech, very modern, and very friendly. Next. This is how I prefer to look at the IMC process itself. I call it the lazy hourglass on its side. We had to do research first before we made any of our decisions and created the IMC campaign. Because without it, we would have, like the website or advertising, we would have gone down the wrong track with so many of our efforts. So research, you have to gather information that leads you to answer other questions, so you gather more and more information, and you finally come down to what is the message that we want to communicate. And I can't emphasize enough, you need to write the message down, print it, type it, do something, but get it specific. So this is our message. Short, simple, clear. From that point, you use the research and you start to build the IMC campaign, communicating that simple message in all the different ways that your research has showed you will work. Easy, right? Marketing and integrated marketing communications is not rocket science. It is pretty good if you do this. Do the research first. Don't assume things or challenge your assumptions. Collect the data. Talk to people that you want to communicate to. Gather all of that, create the message, and then use everything that you learn to communicate with them. The only thing that really is rocket science is the science of making rockets. Most other things in business that I've found, you don't have to be brilliant. You simply have to understand the process, go through it one step at a time, be thorough, and you will most likely be successful. One other slide on IMC. Cross-cultural IMC, when you are trying to communicate with more than one group. Several things that came as a result of this. The best tool, visual impact. Language and cultural barriers can prevent you from using words to effectively reach all the groups. So visuals will do it. Use images that tell a story. The gentleman here, this was his 8th child, I believe. It had been a number of years since he had had a child, and he told the doctors that he thought no more. This baby was a difficult birth, but our doctors were able to deliver the baby, and we got this great picture of him hugging his newborn child. It is a picture that tells a story, but it also says Oasis is a modern hospital, and even though everyone thought it was just a maternity hospital and that's what this was, some of the images showed a much broader range of services. And finally, images that create a feeling. When we talked about electing a president and how decisions are often emotionally based, it is very true in business decisions, in personal decisions. We're making a decision about where am I going to take my family for health care. Emotion is huge. Emotion outweighs everything else. So we used images that created a feeling of Rasheen. Just in the video, just seeing her talking to the translator and then watching her smile when she's talking about the changes made to her foot. The clip in the video, probably 45 seconds long, but makes an enormous difference. People that thought one way about Oasis Hospital at the end of 45 seconds would think very, very differently. Because we told a story and created a feeling with an image. At this time, actually I raised this a little earlier. Are you familiar with high context and low context cultures? Some yes, some no. Real quickly, it's a high context culture. It's a culture where the members of that culture can understand the communication without being needed to be told all of the details. For example, if a picture or a symbol or people refer very briefly to one thing, you can communicate a very complex idea or a long message because in the context of that culture, that symbol is understood. The Arabic culture is a high context culture. A symbol, a picture, an image can communicate very, very effectively. The US is an example of what's called a low context culture, which means you need to explain everything to them. The way I'm doing this presentation, I am doing it as if you were all Westerners, because I'm doing this from my perspective, which is a low context culture, thinking I need to explain every last detail or they're not going to get it. So you get this cross-cultural, I wouldn't say a rift, more like a little bit of misunderstanding when you use one method to try to explain something to someone from a different culture. When it comes to cross-cultural IMC, if one or more of the cultures is a high context culture, you're in luck because you can use images for visual impact to great effect in those cultures. And the reason we did the brochures the way we did, we knew that communicating to the nationals, the symbols and pictures would communicate much more than the text would. But to our Western expat professionals, we needed the text. We needed to explain all the details for them to truly be able to make a decision. So it wasn't completely one way or the other, but definite pronounced one way with one culture and the other. So if cross-cultural involves both low context and high context cultures, images work for everyone, but sometimes you also need text that explain things more detail. Okay, that takes us through, oh, just I forgot to, I don't have another slide showing results. All of our, we missed 2 of our goals. We reached all of our goals with the HR directors, which I thought we would, being such a small group, less than 100 people. Starting off with the dinner at the Hilton, we had great contacts with them, followed up with email and more personal visits, and started to receive referrals from employees that work for those organizations. So those, we got about 50% for each of them. The expat professionals, we had a goal of 40% for 2 of the categories. We made it into the mid-30s, but couldn't get any higher. Just a tough group to reach. Even with our DVDs showing more sheen, just getting those out into the hands of thousands of people, there was no easy way to do it. So in the nationals, we kept our 94%. That thought it was culturally respectful, and we more or less met all the other goals. So it was largely successful, but the area where I thought we might have the most problems, we did have a lot of problems. Any questions? I have droned on for about 45 minutes. Yes, it'd be great to hear someone else's voice.
Yeah, since it's a healthcare business, why the insurance companies were not one of the target audience?
Oh, the insurance companies, yes.
Since the expats, usually they got the insurance companies from the companies, and I think it's a good reference group for them to refer to
Yes.
hospital.
The insurance companies, especially for the major employers, would often they would include Oasis Hospital. They would include all 3 major hospitals in the coverage. So that didn't help those expat professionals make a decision about which hospital to go to. All 3 were equally covered by the insurance. Then the nationals had the government insurance, which also covered them at any of the hospitals. So the system in the U.S., like the one I have, there's several hospitals that are preferred and others I would have to pay more at. We didn't have that situation. So if there were more hospitals, if it had been a larger city and there were more hospitals, the insurance companies probably would have only selected a few. So we would have had the benefit of that. For example, if I was doing this in Abu Dhabi, a much bigger city,
Yeah.
we would probably have that situation, so we would then target the insurance companies to try and get them to approve our hospital. The ones that did not.
Yeah, but I think like in the insurance companies, they have doctors that they can refer to hospitals. I mean, especially in some cases. My question was why the hospital didn't educate these companies about what the hospital does and what they have. I mean, since there's an issue about people, they were not educated about the full service, and that was part of the message.
Good question. Our research had showed us that those 3, the HR directors, were more influential in where that target group of expat professionals, where they chose to go than any other factor. So also all of the insurance companies, none of them were based in Al Ain, and so we would have had to travel to Abu Dhabi every time, and we found that it was much easier to make an impact in person, those personal visits. But I think again, in a larger city, like had we been in Abu Dhabi, then they definitely would have been one of the target markets. But that's a great question, because yes, people will often call an insurance company asking, who should I go see? There were some other smaller target markets that we could have chosen, but one of the problems with choosing too many target markets is then you're trying to craft an IMC message that's going to get to all of them and communicate well. It becomes more and more difficult. I think we were kind of stretching it doing 3. Yes?
Yeah, I just want to ask you about the level of education. Did you think of, while you were creating the campaign, did you think of the level of people who were, the level of education these people with receiving your message?
Yes, we tried breaking down some numbers by education levels. One of the initiatives, which I wasn't able to start, but it was one of those that didn't quite make the cut, but it was close, was from my experience at the Women's College. I knew that we could probably communicate with a lot of the mothers of the students who made a lot of the healthcare decisions that way. And so using the education level of college students to understand the message that we were trying to communicate and then have them spread that was a factor. But I also, as much as I didn't like it, I had a budget I had to work with, and so it just didn't make the cut to do that. As far as the target market themselves, the nationals, we wanted to serve all of them, men, women, children. And so we did not break that down by education levels. And also, many of the older nationals, either their reading skills were not very good. Many of them had eyesight problems. So that's why we used pictures rather than small text that was difficult to read. It's one of those where had we chosen one target market, or maybe two, I think we could have broken that down into the education levels and said that someone with a high school education or college education is who we're going to focus on. The other groups, the expat professionals and the HR directors, those simply by the nature of the work they were doing and why they were there, were highly educated. So I think over 90% of them had at least a bachelor's degree, and probably close to half of them had a graduate degree. Otherwise, they would not have been allowed to be in the country working. So by default, they were already a high education level. Other questions? Yes?
When you say that the hospital for charity work, do you mean it's for a specific group of the society or for all the citizens?
The hospital is not for profit. So it is not a for-profit company. And so it tries to cover its expenses, but it does not, like a traditional for-profit company will have investors that expect to make money.
It's made from the government, right?
No, it's made from an American organization that established it in 1960, but as a non-profit, as a charity. And so it's now 54 years that it's been operating there. And it did not, for most of that, it did not operate using marketing principles, which is one of the reasons why the competitors were able to move ahead of it and take most of the market share, because they had a very old way of thinking. And so the new American CEO, who's the one who hired me, he wanted to keep it as, of course, a charity hospital, not make a profit. But he said there's no reason we can't use business principles to try and recapture some of the market share and get the hospital back up even with the other two. So in a way, it was a little bit of a balancing act, using business and marketing principles, but staying true to the nature of this as a charity institution. Other questions? Yes?
So walking into the situation as a consultant, I'm curious about some assumptions you had about how the case was going to plan out before you did the research. Either assumptions you had or some of the team members that you were working with.
Yes. A number of them. One was because the website was very, very old. I think it was designed in the early days of the internet, like the early 1990s.
Yeah.
So this was very, very basic. It was almost laughable. And I thought that is one of the first things we have to change because it gives a horrible image. The research showed me that while we probably did want to change that, that was definitely low on the priority list. Yeah. I thought that electronic communications would play a much greater role in the IMC program than what we ended up doing. And this was after having spent 2 years living in this culture. I was still surprised at how much face-to-face triumphed any electronic communications. So that was where I had to readjust my thinking quite a bit. Which I was pleasantly surprised. We always talk about how we're negatively surprised about something. The culture of the organization, the hospital itself, needed to change, because that face-to-face in-hospital experience was one of the IMC components. And I thought that would be very difficult and very slow to change. But actually the CEO did a great job of leading people through why we have to change, why we have to be friendlier, why we have to make a better impact on not just patients, but family members that are visiting patients, everyone we come in contact with. And I saw big changes over just 2.5 years, cultural changes within the employees, where I was very surprised, but they did what they needed to do.
Thank you.
Other questions? Yes.
It looks like the presentation there were only primary target audience. I'm wondering if there were secondary, and if so, is there like any surprising results from the secondary target audience, especially like after what the hospital did towards them? Like it's
Yes.
more emotional case.
A secondary audience, though we didn't list it officially in anything, was the Health Authority of Abu Dhabi, HAAD, which was the governing medical body, governed the hospital. All of any doctors we brought from any country had to go pass a test, license from them. And so improving the hospital's reputation overall we knew would be very important to how they looked at the hospital. And so they were definitely a secondary target market. But when you're trying to influence a government institution, you probably don't want to broadcast that. You don't want to say, we're going to try and make you think differently about us. But that was definitely a long-term secondary target market, was to have them look at the hospital. About 5 or 6 years before a new American organization took over, that's who brought in a new CEO. About 5 or 6 years before that, the old organization had recruited an American doctor from New York, very experienced. They thought, this is great, this is who we need. He had been over there, I think, a little over a year. And someone discovered that his medical license had been revoked in the US. He was no longer allowed to practice because of malpractice. And no one had caught that. And actually, that was one of the reasons why the Health Authority of Abu Dhabi implemented much stricter procedures. So actually, all of the hospitals now had to do more work because of what OASIS had done. So if you look at it, there were many secondary target markets, how the rest of the medical community looked at OASIS Hospital. It's like, you're the one that made us go through all these extra hoops. So we wanted to bring the reputation of the hospital up for a number of reasons, besides our 3 main target groups. But in terms of marketing and bringing business, these were the 3 groups. But in terms of other reputation with the government, with the medical community at large, there were definitely